everybody.
Morning, everyone.
You're all very welcome. It's lovely to see you all here today. I'm Bex Barker. I'm the chair of SDSS, and this is Donald.
Hi there.
Chief Exec. So it's really, really lovely to have you all here today. We're absolutely delighted to see that we've got 170 people here in person and a further 50 online. This is our biggest SDS National Voice conference yet. The boring stuff. There's no housekeeping, except to say that as well as the venue staff, you'll spot the SDS team, the SDSS team. We're all wearing these snazzy orange lanyards, so if you need anything, please collar one of us and we'll do our best to help you. We're here all day, so don't be afraid to speak up if you need that help. We do have a quiet space. It's upstairs. It's dressing room 1 on the first floor. And you can find the details for the programme today in your programme, which you should have with you. We have a photographer over here who will be sharing photos on social media and after the event. Please do let one of us know if you don't want to be in a photo. Likewise, we'll be filming this event to stream to the people online and making recordings of the presentations. We'd like to say thank you to our event sponsors, Navigator, who are employment law and HR specialists. Their support for this event has meant we can offer free spaces to supported people and carers. They have an information stand in the foyer, so you can have a chat with them during the breaks. I think I noted that they had chocolates on their stand, so that's definitely worth going there. And they're also here to give their expertise in a workshop this afternoon on how to navigate employment law and HR issues. Specifically for people who employ their own personal assistants and organisations that support employers. I'm now going to hand over to Donald.
Morning, everyone. Warm welcome to this year's National Voice, A Decade of Learning. And it's really wonderful to see so many of you. It's the first time we've all been together. For some, this is still one of their first outings after the pandemic, so it's quite an emotional time for some people in some ways. Either way, it's lovely for us all to be together and marvel at how short or tall we are offline. When I joined SDSS during the pandemic in August 2020, we were in the middle of research that was delayed due to COVID, My Sport, My Choice. It's still the largest body of research into people's experience of self-directed support with accompanying recommendations. So after 10 years of SDS implementation, some of the learning condensed in that exercise resulted in a lot of changes through things that we've all been involved in. So we've had the SDS standards developed by Social Work Scotland, the independent review of adult social care that most of you will have been involved in, the review of the statutory SDS guidance, the PA programme board and its outputs, the national SDS collaboration and the SDS improvement plan. So these have undoubtedly brought about improvements, but that's not always been easily achieved. There are currently immense pressures on the social care system that have been adversely affected SDS implementation, with challenges for those delivering services from support providers and brought about a perceived need for more safeguarding for registration of option 1 employers' workforce and for more limitations placed in people's choice and control. There's been a greater need for co-production and some wonderful examples, the outcomes of some of which we'll hear today. That co-production that we've had with the Disabled People's Independent Living movement has highlighted the need for more capacity building within the movement in order that the people's collectives, the disabled people's organisations, the Centres for Independent Living, the independent support organisations, that they're all empowered and resourced robustly enough to support people themselves to achieve their choice and control through SDS. We've all been involved in working across governmental policy to improve implementation, recently around equalities, where the disability equality strategy was stalled, but is hopefully now moving forward, following a really useful meeting that we had last week with the First Minister and a group of disabled people's organisations focusing on the realisation of our human rights. Today's a chance to look at some of the positive developments that there have been over the past year with several launches to improve implementation. Following the success of the huge online handbook resources that supporting PA employers and PAs, today we're launching the SDS handbook. You'll be able to have a look at that, and I think you can see there's a computer in the foyer that you can have a look at it on. So that's a one-stop resource for anybody looking for information, guidance and signposting in SDS. We'll later hear about the progress of research findings coming about from the By My Side survey into independent sport organisations, and thanks to everyone for filling that out so quickly. There are several outputs of the PA Programme Board coming to fruition, and we'll launch the training framework for PAs today, and their employers, and the National Brokerage Framework. They've both been published today, and we've also launched a revised and improved My Job Scotland page, a recruitment page for PA advertisements. SDSS is a disabled people's organisation, and we're born of and an integral part of the independent living movement. We're also a membership organisation comprised of 61 members, most of them independent sport organisations, that provide the infrastructure that's needed for everyone that needs social care. Last year, we published a report on autism in SDS, which resulted in a programme of development. And this year, we've commissioned reports on SDS and dementia, and one on SDS and alcohol and other substances. And we've got a workshop on that last topic being delivered this morning for those of you who are joining us online this morning. So we look forward later on to hearing from the PA Network Scotland as they relaunch their work as a full member organisation. And we also welcome Peter Scott, who's going to talk about the relaunch, the launch of the reopened ILF, which has been warmly welcomed by our community. Later this morning, we'll hear from an expert panel, sharing their views about some of the questions that you've sent in, so thanks for doing that in advance. And it's followed by an afternoon of really interesting workshops, both in person and for the people joining online. I'll shortly invite the Minister for Social Care, Mental Wellbeing and Sport, Marie Todd, to open our conference. She's been fully engaged with the work on SDS implementation, with specific commitment to the development of the PA workforce through the PA Programme Board, and to ensure that SDS becomes a cornerstone of the National Care Service. But before I introduce the Minister, I'd like to introduce you to Anne-Marie Monaghan, who's familiar to many of you, to say a few words about the development of the brokerage infrastructure to support SDS. This having been a passion of hers for at least 10 years, Anne-Marie. I'll hand over to you.
Thanks very much, Donald, for the invitation to say a few words about brokerage. And I did say, Donald, yep, definitely, I will keep it short. And those of you who know me know how hard that'll be, right? But unfortunately, I've usually got plenty to say, but I will be short and sharp. So today, we launched the National Brokerage Framework, which has been co-produced by many of you in this room. And I want to thank everybody for the contributions that you've all made. It's been hard going at times, but we got there in the end, and I think we've got a great piece of work, so thank you for that. We've got a three-pronged approach to brokerage in Scotland, and it's the community model that we have adopted. We've got the framework that we're launching today, which sets out how we can continue to improve the practice of community brokerage in Scotland. We've got the Community Brokerage Award. That's an SQA accredited award at level 7. And for those of you who don't really know much about that, that's actually HNC level. So it's quite a piece of work involved for those who do that. And we're very grateful to the Scottish Government for funding a number of places on this award last year. And the third part of that is the Community Brokers Community of Practice, and that's for those who have completed the award and they want to keep their practice up to date. There is information about all three aspects of the community brokerage work available in the foyer today. And we've actually got a new intake of students that's just starting today. So if you're interested in doing the award, please speak to myself or Jenny Rike, who you'll see floating about. Look for the name badges. But my main reason for this wee spiel today is to recognise all the individuals who have been through that award and those who are currently doing the award. At the moment, that's over 87 people. So I'm really going to embarrass every single one of you, and I'm going to ask you to stand up. So if you've done the Brokerage Award or you're on the Brokerage Award, there's a number of you in the room. Do you want to just stand up and let's see who you are? Well done, everybody. That's brilliant. You know, I'm really glad that your achievements were recognised there, and to thank you all for the contribution you've made to the development of community brokerage in Scotland. And you come from the length and breadth of the country, so doing it online has been excellent, and it's been a real pleasure to work with you over the last 3 years. And I know that not everybody could make it today, so we want to extend our congratulations to those who couldn't be here. So thank you everybody for all that you've done for brokerage, and just to conclude to say that we're going to have a photo opportunity just at the start of the lunch break. So if you could make your way back here or stay here or whatever just before lunchtime, if you want to be in that picture, it would be great to see as many of you as possible. So thanks very much. Thanks, Donald.
Thanks, Anne-Marie. So I hope you have a great day. It's a great chance to meet friends and colleagues that have been working together over the years to do what they can to improve social care in Scotland for people. Thanks to the fantastic team at SDSS. They do an incredible job and give the illusion of a very large resource, given their output, imagination and commitment to being the bridge between policy and implementation. So 4 years later, and 4 stone later for some of us, I certainly feel that the various components of the landscape work together more effectively. Donna Murray from Social Work Scotland referred to this as the big holy SDS blanket. And we've got a lot to do in ensuring that SDS is fully implemented and its delivery is fit for purpose and being a cornerstone of the National Care Service. But today the blanket feels a bit less holy, thanks to you all weaving together your expertise and commitment to improvement. And you can have a good groan now at that metaphor. Okay. So I'd now like to introduce the Minister for Social Care, Mental Wellbeing and Sport, Marie Todd, MSP, to ask her to open today's event. Ms. Todd.
Thank you. Thanks very much, Donald. So I am really short in real life, so hopefully everyone can see me. Morning, everyone. I'd like to start by thanking Donald and the team at Directed Support Scotland for inviting me to give the keynote speech today. I was absolutely delighted to be asked to join you all here today and to welcome you in person to this year's Self-Directed Support Scotland conference. We're all still giddy with excitement when we see each other in real life. I also want to welcome our virtual attendees joining online, because it's great that hybrid events like this are able to include so many people who wouldn't have been able to attend in person. And that means I'm able to hear from and speak to a whole much wider group of people with different social care support needs, experiences and challenges. So whether you're here in person or here virtually, I want to say a huge thank you to everyone supporting the event and for your commitment to improving self-directed support, or what we probably call SDS in Scotland. I'm really looking forward to speaking to you all this morning as we come together to reflect on 10 years that have passed since the Self-Directed Support Act became enshrined in law. It's lovely to look out into the audience and recognise so many faces that are familiar to me from my work, and it's just on SDS, and the very many other policy areas that are so interlinked. I don't know if I want to start the analogy of my portfolio being like a holy blanket, but I'll work on that one. So we're here today to celebrate the impact that SDS has had on people across Scotland in the last 10 years, and also to bring some focus to what progress is still to be made as we move into the next decade. So I think that everyone in this room shares the common goal of continuing to improve the implementation of the legislation and in turn the lives of supported people in Scotland. So 10 years ago, we embarked on a mission to empower individuals and their families to have greater choice and control over their lives, their care, and the support that they receive to help them to live the way that they want. Sounds simple, doesn't it? The SDS journey began with the passing of the Social Care Self-Directed Support Act in 2013, which laid the groundwork for a person-centred approach to social care in Scotland. The legislation signified a really fundamental shift in mindset, and it recognised that individuals are the experts in their own lives and should be fully supported to make their own decisions about their care and support. Through collaboration and the tireless advocacy and perseverance of the many people in this room, we've transformed the landscape of social care in Scotland. The Support in the Right Direction programme, now commencing its 7th year, is just one example of that collaboration between government and support organisations. Independent support, advice and advocacy are absolutely key to the success of SDS implementation. We've been told that time and time again, and we're delighted to have this year committed to multi-year funding of the SIRD programme. That'll take us up to 2027, providing some much-needed stability for the funded organisations that do so much for supported people, their families and carers in Scotland. Since then, we've witnessed the tangible impact of the introduction of self-directed support in the lives of countless individuals across Scotland. Through personalised budgets and tailored support plans, people have been able to live more independently, pursue their passions, and participate in their communities in a way that just wasn't possible previously. Naturally, though, our work is far from over, and while the SDS Act was a significant step, I know that there are still many challenges facing us, and I think every single one of us here in this room and in the virtual room recognise the need for further improvement in SDS. The independent review in adult social care showed us that self-directed support is a very popular policy, but it told us that we still have work to do on implementation. It's not right that an individual in one locality has limited options available to them in comparison to their counterparts in other areas of the country. As we look to the future, we have to recommit to fully embedding the principles of SDS right across the whole of our social care system. To address some of these issues, the Scottish Government remains absolutely committed to the establishment of a national care service. That was a key recommendation of the independent review of adult social care. The creation of the NCS is on the horizon. It'll bring with it greater consistency across the country, tackling some of that inequality that we see in the system at the moment. With the NCS will also come greater financial clarity and transparency, something that becomes more and more important as financial pressures continue to build. We've committed to including the principles of SDS within the National Care Service, and that commitment hasn't changed. But improvement can't wait for the National Care Service, and in the meantime we're continuing to drive forward improvements in SDS through a number of grant-funded activities outlined in the Self-Directed Support Improvement Plan, which was published jointly by the Scottish Government and COSLA last year. This national plan aims to move forward the implementation of SDS from 23 until 27. Now, the overarching aim of this plan, aligned with the intention and values underpinning the SDS Act, is to support and enable people to achieve the outcomes that are important to them and to lead full and meaningful lives, to participate in and to contribute to the economy and society. We've also worked to update the SDS statutory guidance, setting out clearer expectations for local authorities and aiming to get rid of some of the much-hated jargon that only served as a barrier to implementation. The National SDS collaboration, attended by many of you, ensures that government officials are connected to people with lived experience, and my officials tell me regularly that the input of this group to both the guidance and the improvement plan has been absolutely invaluable. More recently, we've welcomed the Parliamentary Committee for Health and Social Care and Sport that undertook a post-legislative scrutiny process into how the Self-Directed Support Act has worked since it came into force in 2014. And I know that lots of you, both as individuals and as part of an organisation, took the time to respond to that first call for evidence in January this year, and I want to say thank you for that. It's such an important opportunity to hear from the people who experience SDS in action every day, both working in the sector and as recipients of support. Now, the main focus of that post-legislative scrutiny process is whether or not the Act is delivering the expected outcomes and to what extent, and if not, why not. And we expect to receive a first round of feedback from the committee in the summertime, and we look forward to hearing from the committee and using their feedback to further influence progress towards better implementation of the SDS legislation. Now, the agenda for today is testament to the depth and breadth of work being undertaken on SDS at this very moment. I can't stay longer, and I'm really sorry about that. I've got to be standing up in the chamber, I think by about 11:30 this morning. But I hope you take full advantage of the carefully curated workshops that are on offer this afternoon, and I really look forward to hearing about it in due course. You'll hear more today about the reopening of the Independent Living Fund, an initiative that sits right alongside SDS, further supporting and empowering disabled individuals to live independently. And last but not least, I'm delighted to have the opportunity here today to announce the official launch of the new Personal Assistant Network Scotland membership organisation, PANS. So PANS is the trusted national membership or services organisation representing PAs in Scotland. It'll help us grow the PA profession. It'll support PAs and listen to what PAs want. And with this organisation established, we'll begin to hear the PA voice more strongly. I know that Les Watson at the PA Network's providing us all with a fuller update and overview of the new website, but some exciting benefits for members will include individual specialist advocacy and support, a range of discounted membership offers and benefits, including the Blue Sky card, membership of Unite the Union, as well as the PA ID badge and insurance. So the PA Network Scotland team are on hand today to help with any questions you might have about their membership offer and where to find the details of the new website. And please also reach out to my officials in the PA policy team who are also in attendance if you want to introduce yourself or have any questions. So, as we reflect on the last 10 years today, let's make sure that we celebrate our successes while learning from our experiences. Let's take this opportunity to recommit ourselves to that vision of empowering people to live their lives on their terms. And let's be sure that together we can continue to create positive change for supported people in Scotland. So thank you all for your dedication, your passion for the principles of SDS, and for pushing us in the direction of positive change. And thank you once again for having me here today. And I'm very happy to try to answer your questions. Thank you.
Thanks very much, Minister. And I think people had sent in questions in advance. So, Anne-Marie, you had a question you were going to ask? I think Joanne's just coming to you. We can hear you, though.
Need to wait for the white mic for the folk online.
Thanks very much, Dawn. And thanks, Minister, for taking this question. On the recommendation from the independent review of inspection, scrutiny and regulation concerning the registration of PAs, you've supported a co-produced register for PAs, but you said you've no intentions of making a decision until the PA programme board had reached its conclusion so that it would inform what that register looked like. Disclosure Scotland will require PAs to register with them, and through that process there will already be a register created, albeit through stealth. Surely there must be a way to avoid the need for an additional register. However, given that you've accepted all of the recommendations from the review, that raises a concern for many of us who use PAs that we're on the thin edge of a wedge that would take us to regulation of PAs, and we find that quite concerning. So what do you, I mean, in your own mind, what kind of vision or what do you envision a co-produced register would look like, and who, for example, will be responsible for the register? Will it be voluntary? Will it be mandatory? Just to get a kind of idea of what you're thinking is around that will be very useful, because many of us are clearly not in support of that direction of travel. I would just like to hear a bit more from you on it, if that's okay. Thank you.
No bother, absolutely. And I suppose the first thing to say is I absolutely understand the sensitivities around this recommendation and the very unique relationship between a PA and their employer. And I did think very carefully before deciding to accept the recommendation. I mean, I spoke at another meeting with you, Anne-Marie, and I said I understand the concern that people are feeling, because I recognise that day in, day out, disabled people have their autonomy eroded and challenged, and I am determined that as accepting this recommendation will not do that. I know that you've made enormous progress already with the work that you're doing, achieved by the programme board for PAs and their employers, and that you're still driving that crucial work forward. So I would say that one of the first things to be very clear on is that I don't intend to begin work on that recommendation until we have completed that programme board work. So it is all going to wait until we have finished the work that we started already. The programme board work will lead to PAs who are better recognised, who are supported as part of the wider social care workforce. And my colleagues and I will continue to support the board to complete that work plan. So I won't be thinking about implementing recommendation 8 until we've done that. And at that point, we'll consider what more is required to improve the landscape. Now, on the Disclosure Scotland question, the Act, which I worked to steer that legislation through Parliament as Minister for Children and Young People. It will introduce a mandatory PVG membership and other changes. Disclosure Scotland will implement those changes by April 25. The mandatory scheme will mean it's an offence for an individual to carry out a regulated role without being a member of the PVG scheme. But it's not a register. It won't be a register of PAs. It will never become a register of PAs, and it isn't intended to be a register of PAs. It might give us an indication of the size of the PA workforce in Scotland. Most PAs will be carrying out a regulated role, but there will be some exclusions from the mandatory scheme where a PVG check isn't required. For example, people who are family members, PAs who are family members, or who share the same household with a person receiving care, they won't be in a regulated role. And people who have a personal relationship with the person receiving care who aren't family members, they won't be in a regulated role. So there won't be the two populations won't overlap, and it definitely won't be a register. I want to make it absolutely clear, in case it's not clear, that recommendation 8, and it's not that I want to say that we're just paying lip service to accepting it, but I accepted it because I think there is a challenge for us to face, and there is work for us to do to understand why that recommendation was there. I think there is a problem to be solved, but I am absolutely not going to look at it until we finish the work of the programme board. And then we will look at that and decide together whether more is needed. It'll depend on the context after we've done that work, whether any future action is necessary. We might find that the programme board work being completed solves that problem that we recognised that was there currently. If we need to do something, the IRISR recommended a co-produced and bespoke scheme of registration for PAs, which recognises their skills and roles, which opens up access to training and development. And that would absolutely be about not creating new barriers. And I would say that, I am totally committed to that co-production piece. So you asked me what my vision is, and I'm like, my vision isn't the important vision. It is that collective vision at that time. So I will, of course, if I'm still minister then, have some say in what we do, but it's your thoughts that will be shaping that step in the future. So I love working with you guys. I look forward to continuing to work with the PA Programme Board and its members, as well as all the other groups with an interest, so regulators, providers, partners, other folk with lived and living experience. And we will work together. We'll build on the good practice that we know is there. We'll rise to meet the challenges that we know are there. And we'll work together to find a solution. Thank you.
Thanks, Minister. Okay, Anne-Marie. Thanks for your question. On the back of that, there was a follow-on question, Minister, from Jim Elder-Woodward, who can't be here today. He's saying, it seems that regulation itself creates a barrier to self-determination, no matter who controls the regulation, and that having disabled people in control of regulation could actually make regulation more difficult to criticise. So he was asking what your view on that was.
So, Jim and I have very many candid conversations, as you might expect. Those of you who know Jim, he's not afraid to speak truth to power. And I absolutely understand that fear of having your autonomy eroded. And I am very honest. I joke about it. I am all about the independence. I am, to my core, an independent human being. My politics are about independence. I want my country to have autonomy. I value my own autonomy. And I absolutely recognise that for millennia, people with disabilities have had their power taken away from them, and they've had their autonomy removed. And I recognise the fear and concern about that. I recognise the distrust of some of the people that you rely on to look after you, and I've had, I'm heart sore about that, but I promise you that Scottish Government understands that concern. I guess there is a need, I think there is a problem to be solved. There is an absolute need to ensure high quality, safe support for people who are PAs and their employees. And I have to balance my responsibilities as ministers to everyone. This is, being a minister is all about compromise and finding the middle path. I think there are really incredible work, and I acknowledge the amazing work that's being done by the programme board to find solutions to the issues of support and protection, and to prevent abuse, and to ensure good working relationships. And I would be really interested in more conversations about that and the wider SDS National Collaborative if we want to work something up. I think there are I think that the reason they made the recommendation is because there is a problem to be solved. I mean, I said when I was chatting to Anne-Marie, I said no employer works entirely outside of regulation. You know, we're not a completely unregulated labour market. When you're employing someone, you have to, you know, you have to keep records, you have to pay tax and national insurance and things. There is a regulated landscape out there. You're not completely free to do as you wish. What we need to do is make sure that anything that we bring in supports and empowers people rather than providing more barriers and more restriction, and absolutely does not erode autonomy. I know that that relationship is precious. I see it day in, day out, and I hear it day in, day out from the people I interact with, and I do not want to disrupt that relationship.
Thanks very much, and that's great to hear. The next question we've got is from Tressa Burke. Tressa. Hold on, you'd sent in this question. There's a copy of it.
Sorry about that, Minister, sorry about that. So how can you support local government to invest in and collaborate with DPOs, including the CILs that obviously you spoke about, the relationship in supporting disabled people through their SDS and social care journey? So realising the UN Comment 7 in the context of Verity House Agreement, which I think you know we're really concerned about.
I know. I mean, everybody's very concerned about the Verity House Agreement, and I suppose you can see the challenges of working together in that way play out day in, day out. If you read the papers, you will hear lots of concerns about I think it's mainly me they're complaining about, but we have to. I mean, I have absolutely, I understand the concern, and I understand that many people in this audience will have felt let down by local government, maybe more than once over the course of your lifetime. I understand that you don't trust them to uphold your human rights, and I absolutely get that. I am of the opinion that we are not going to achieve what we want to achieve unless both spheres of government are involved. And we will work together to make sure that both local government and Scottish Government deliver for disabled people. Now, the UN General Comment 7 is absolutely clear that disabled people should have full and effective participation on decisions that impact them. And the Scottish Government does that all the time by embedding lived experience into our policy making. And to be honest, that's not just because policy tells us to do this, or the UN tell us to do that. Actually, in my day in, day out life as a minister, I find that working with people with lived experience helps me to get it right in the first place. So when I'm developing policy or legislation, making sure that people with lived experience have a strong voice in that process helps me to get it right. And then the other joy, so the biggest challenge for me as a minister is that gap between we have fabulous ambitions and ideals and all sorts of lofty, great things we want to do, but there's a challenge between what we aim for and what actually happens on the ground. And that having lived experience helps us to understand that implementation gap and holds our feet to the fire on delivery. So I'll be working really hard, and it's a red line for me in the National Care Service to make sure that lived experience has not just a voice, but a strong and equal voice in everything that we do. And I'll be working really hard to help my local authority colleagues to understand that it is in their interests to work that way. They want to deliver in the same way as I want to deliver. People come into politics, whether it's local government or whether it's Scottish Government, they come into politics because they want to change the world. The local authorities are going to be more able to change things if they work with lived experience. So I think it's really crucial that we work that way. The Verity House Agreement it's not good for people on the ground if we are constantly banging against each other and blaming each other. Things are really tough at the moment. There are financial constraints at every level of government in this country. It is of no comfort whatsoever for people to hear us blame each other for not having enough money. People want to see us work together in the situation that we're in, the reality that we face, work together to make progress. And I am absolutely determined to do that, because I recognise, like I'm somebody, I always say to people, I came into politics, as everybody does, because I wanted to change the world. And of course, quite quickly you realise you can't. I alone cannot change the world. I need to bring people with me. I need to work with people who really can change the world. People like you, Tressa, who really have, over many years, changed individual lives. I don't even need to do that work. I just need to empower you. And I'll do that. Unleash you on the world.
Thanks very much, Tressa. Thanks very much for your question. I think we've still got time for another couple. We've got Donna Murray from Social Work Scotland.
Thank you. Good morning, Minister. And it's so good to hear about that collaborative approach that you have. But I did want to point out that we're still a lot of silo working. And so my question is, how do we move towards a system that ensures different policy areas talk to each other? What steps is Scottish Government taking to ensure that social care policy decisions, for example, self-directed support in the National Care Service, and actions linked closely to other areas of work, thinking particularly about health and housing and community policy areas? Thank you.
Yeah, not a tiny question to finish on. And you're absolutely right. I mean, I've come to the conclusion that it's kind of a human thing. It's like a human trait to silo, and particularly under pressure as we are at the moment. So the health and social care system as a whole is under more pressure than it's ever experienced, I think. And that almost the natural human response is to close down and do your own little bit and to protect. And actually, human beings don't work that way. Human beings aren't just, I often think from a health perspective, we have a very, our healthcare system can feel very fragmented as people navigate it. And I always think people are more than an organ system. I'm not just a heart. I'm not just a set of lungs. I'm a whole person with a life, with a family, and with a role in life, all of which is important for my health. And I guess we need to, so I always say the protection against that siloed working is to look at the human being in front of you as a whole. I think the other thing is that recognition that we can't do it on our own. And I mean, most people working in health and social care want to make people's lives better. That's why they do the work that they do. So despite that natural tendency to silo down and just take care of your own part, that recognition that you will do a better job and make more impact if you work more broadly, I think is really key. Then we have a few programs that we're working on that are forcing us to work together. I mean, the National Care Service is a big, old, complex system. That alone is touching on many different aspects of people's lives and many different parts of work right across the health and social care system. But we're co-designing Getting It Right for Everyone, GIRFI, and I really like that programme because it puts the person right at the centre. And it wraps services around them. And in the same way as GIRFIC, Getting It Right for Every Child. And I'm not saying things are perfect, but that really did transform the landscape for children. It meant that they were at the centre of the team that were looking after them. And it also prevented those children from falling through the gaps. And GIRFI will do the same for adults. It will absolutely make a difference, and that requires us to all work together, to look at every aspect around a person, to try to work together to deliver. I mean, I suppose one really important thing, I would say you can't achieve health, or, if you think of Maslow's hierarchy of needs, which will be familiar to everyone here, housing, having a home is a really important part of that. And whilst we're not bringing housing. I don't intend to bring housing into the National Care Service. I recognise it's absolutely vital. So it can be the key to independent living is having the right kind of home. And your home is so important to the way that you interact with your family and your community, and it's crucial. So we absolutely will be working with housing, and there's lots of liaison going on already to try to make sure that that bit of the integration piece works really well. I suppose I'll just go back to where we started. If we start with the person in the middle, and I'm a health professional, so I always say person-centred, and Jim Elder Woodward always corrects me and says person-led, Miri, person-led, and he's right. So if that individual is in the middle of everything, leading what happens around them, we'll get it right, and we will work across boundaries.
Okay, thanks very much. And I know that you need to leave now, Minister.
I do.
Thank you very much.
No bother at all.
For joining us today.
No bother. Thank you.